Today's topic of discussion is ACL related injuries and its treatment. Hello everyone, I am Dr. Lalit Bafna. I am arthroscopy and joint replacement surgeon working at SCI International Hospital, New Delhi. So, ACL is a very common injury these days and its incidence increases day by day. Therefore, I chose this topic for today's discussion. Today, we will discuss what are the common questions patient ask and what is its answers to the patient. The first question, what is ACL? So ACL is one of the strong ligament inside the knee joint which connect a shin bone to a thigh bone. What it does? It provides a stability to the knee joint, both front and back plane. Therefore, it prevents sliding out of the leg bone against a thigh bone, as well as it provides rotational stability to the knee joint. How does this injury occur? Usually, ACL injury occur in a twisting way or in a pivoting type of injury. So whenever knee is extended or in a straight position, it is a stable position. All ligaments are taut and there is less chance of ACL injury. As knee bends, ligament get relaxed and the knee becomes more prone for the ACL injuries. So usually patient's landing becomes wrong or in a flex position. If there is abnormal force act on a knee joint, it may lead to ACL tear. What are the most common complaints patient will feel? Patient will listen a audible pop sound immediate after injury. He will not able to put weight or stand on affected leg immediately. He will have pain, he or she will have pain or swelling. Once swelling subsides, patient will experience a recurrent episodes of buckling or give way or instabilities. So how we diagnose ACL tear? So ACL is diagnosed by three ways. First is a detailed history taking. Second is examine the patient, and third is investigations, which includes X-ray and MRI. What are the important points in history? First thing, how old is the injury and what is the mechanism of injury? What is the patient's age, what he used to do, and now how many episodes of instability he is getting. Next question, what is the wish for post-surgery? What are the sports activity he used to do and what are the sports activity he wants to come back, and what are the associated other injuries? So these are the very important points one should note down in history. In examination, we do a special test like Latchman test, anterior drawer test or pivot shift test. That will tell us patient has ACL tear or not ACL tear. Investigation, we do get X-ray to know whether there is any associated bony injury, and the main or important investigation becomes MRI knee. MRI will tell us or rather confirm our diagnosis of ACL tear, and it also tells us whether a patient has associated injuries like meniscal injuries, PCL injury or any other ligament injury. Now, after diagnosing ACL tear, the next question, what is next? What needs to be done? So, there are treatment options, becomes two important treatment options. First is non-surgical in the form of physiotherapy, exercise and knee bracing. And second thing becomes surgical. So, let's discuss a surgical option. So, what are the indication of surgery or who are the right candidates for surgery? First thing, young active male who is indulging with the sports activity and who wish to go back to its original state. Second, those patients who experience a recurrent episodes of knee instability. And third thing, when patient has associated injuries along with the ACL injury. So patient usually asks, can ACL tear heal by itself? So ACL is basically a poor healer, as a torn ligament is continuously bathed in the synovial fluid. Therefore, it won't heal completely. Only a few subset of patients who have a grade 1 sprain or partial tear, mainly in a children age group, may ACL heal in those patients. Is surgery needed in all patients? You can say 70 to 80% patient will need surgery, especially if patient experiences episodes of instability. Only a few subset of patient which has a partial tear and stable on knee examination, children and old age patient who has a sedentary lifestyle and those who are already developing arthritic changes inside the knee joint may manage with conservative or non-surgical method in the form of exercise and physiotherapy. What happens if I delay my surgery? This is another important question. You can delay your surgery by a period of 15 days or a month till you reschedule your appointment. The only thing you should continue doing that is continue doing quadriceps exercises. You should not indulge in any sports activity during this period or any cutting or activities which may lead to a giving way of your knee joint. I will recommend if patient is having a meniscal tear or any other ligament injury along with the ACL tear who is suitable for a repair or early surgery, they should avoid delaying of their surgery. So what are the surgical steps in arthroscopic ACL reconstruction? Basically, it's a very skillful surgery. We give a general or spinal anesthesia to the patient. Surgeon usually creates two small few millimeter hole along the side of the knee joint. Through one hole, they put an arthroscope or a camera through which we visualize a knee joint, and through second hole, we tackle the torn ACL ligament. We clean up the ACL ligament and we replace it with patient's own strong tendon. In order to achieve this, we create a drill socket or tunnel inside a thigh bone and leg bone, and we use various fixation devices to fix a ACL tendon. Basically, this tendon will form a roadmap to regrow a new ACL ligament. We called it as ligamentization of the tendon. Usually, it takes 6 months time for complete recovery. So, how patient do post recovery? What is the rehabilitation stage? So, we guide for a rehabilitation, and remember, rehabilitation becomes an important part of the treatment. In first 6 weeks, we focus to gain a range of movement and quadriceps strength. In next 6 months, we focus on strengthening of quadriceps, hamstring and core muscle. From 3 months to 6 months onward, we do a sport specific rehab, and after 6 months, the focus will be on return to sports. Usually, we give knee brace and walker for first 2 to 3 weeks till patient becomes confident. Once patient is confident, we can discontinue knee brace and walker. Patient can resume his job in minimum 2 to 3 weeks time. He can do a stationary cycle at the end of 1 month. He can join back a swimming at the end of 1 month. Car driving at the end of 1 month or 1.5 months to 2 months. We can resume jogging at the end of 4 to 5 months, and we can start running at the end of 6 months and return to contact sports at the end of 9 months. That will be a rehabilitation protocol for the patient. What are the complications of surgery? Usually, all surgeries are associated with some or other complication. Arthroscopic ACL reconstruction can lead to infection, bleeding, neurovascular injury or stiffness. Patient should remember, if his original ACL is torn, then there is a chance that a reconstructed ACL may also get torn in the future. Therefore, he has to be careful post surgery. Thank you.